This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Welcome. My name is Dr. Sarah Cucurullo. I'm the Chairman, Residency Program Director, and the Medical Director for the JFK Johnson Rehabilitation Institute in Edison, New Jersey. We're very excited that you're here today, and I'd like to go through some of the key components of our program. The JFK Johnson Rehabilitation Institute is located in Edison, New Jersey. We are the Department of Physical Medicine and Rehabilitation for both Rutgers Robert Wood Johnson Medical School and the Hackensack Meridian School of Medicine. We are attached to an acute care facility called JFK Medical Center. It is a 475-bed acute care hospital. This is a tremendous benefit to our residents in that we have consultants and medical support for our residents attached right to our rehab institute. Many of the consultants have privileges at both Rutgers Robert Wood Johnson Medical School and Robert Wood Johnson University Hospital, in addition to JFK Medical Center. So our patients that come from these facilities have a great continuum of care. We have a 24-hour code team, and we have many other benefits of being attached to an acute care hospital. I'd like to talk to you about our academic curriculum and then our clinical curriculum. We have a very structured academic curriculum that covers the 12 main topics in the field of PM&R, with which we follow the self-assessment curriculum. Those 12 topics are covered month by month. So each month we cover a separate topic during our protected block time from 8 a.m. to 1 p.m. We have visiting professors, journal clubs, grand rounds for each didactic month that focuses on one particular topic. My topic happens to be stroke, which occurs in September. The curriculum over the course of 1 year covers all the 12 topics of PM&R. So we have the benefit of having our curriculum repeat 3 times during the duration of the residency program. And as I said before, the entire month is committed to each of these 12 major topics, where guest speakers and workshops are built directly into that academic curriculum and our protected block time. Part of our academic curriculum is a senior board review course. It runs from January to June during their senior year. It follows the SAE curriculum that is an extension of our academic curriculum that occurs the 3 years during their training here. And we have published a book, the PM&R board review book, that contains the notes from this board review course. It is covered over that 6-month period of time, and by the end of their training, the residents are ready to take the mock exam and the actual board exam that occurs in August of their post-graduation of their senior year. We do mock exams for part 1, but we also do mock exams for part 2, in which we prep the residents for their oral exams. Other aspects of our academic curriculum include a cadaver course and outside courses, which is a benefit because we are in the tri-state area, so we benefit from some of the strengths of some of the other programs that occur in this particular area of the country. So being in the tri-state area, and including Pennsylvania, we benefit from those programs. Within our program, we have workshops that occur, which includes spasticity, injection workshops, trach workshops, and we have monthly ultrasound workshops where the residents get 2-hour workshops and work with the sports medicine trained physiatrist boarded in sports medicine, and he trains our residents in ultrasound, which is extended then into our clinical realm. We have research opportunities and a research requirement. Our clinical curriculum, probably one of the most beneficial aspects of our clinical curriculum, is that we have a 1-to-1 attending teaching ratio with individual teaching assessment of each resident. The rotation schedule is formatted to allow the residents to focus on the specific areas of PM&R. Each block is broken into a 3-month curriculum. So we focus during your PGY2 year on brain injury, cardiopulmonary, spinal cord, and stroke. As you can see, there's multiple different areas in the PGY3 area as well, and the PGY4 area as well. Our clinical curriculum, part of the assessment is our clinical competency program that assesses the competency of each resident at the end of each rotation. Each resident during each one of their rotations will get a full clinical competency assessment that will make sure that they know how to do all appropriate procedures and all exams for each one of the individual areas that we cover within the clinical realm. That there's ample hands-on experience for all of the procedures that you see listed here. And we not only meet the ACGME requirements for these hands-on experiences, which include EMGs, ultrasound, Botox injection, joint injections, in addition to many others, but they not only meet that requirement, but they exceed it. We have another unique aspect about our program is our 3-month elective. 1 month is allowed out of house, which allows residents interested in fellowships to showcase at other programs. In addition, we have 2 months that are required in-house that allows for research and specialization. We have an optional sports program for anyone interested in sports. They can be involved in high school football games, physicals, and wrestling weight certification. We also have fellowships here that are offered at JFK Johnson. One is an ACGME pain management fellowship, and the other is a brain injury medicine fellowship. Our graduates, about 50% go into private practice and 50% go into fellowships. The recent fellowships obtained here include brain injury medicine at Mayo and Tears program, pediatrics, pain, and sports medicine, all of which are very prestigious fellowships that our residents have matched into. The professional careers that we have for our residents include, as I said, both clinical, and they either do fellowships or they can go into a professional career directly. That includes go into academics, which they can go to any of the programs listed here. And our graduates have also gone into private practice setting. I'd like to thank you for being here today with us to learn about our program. If you have any questions, reach out to our program coordinator, Beth Bolger. Her contact information is there. I'd like to also encourage any of you that may have questions for me to ask, please contact Bev, and I'd be happy to answer any of the questions you have about our program. I wish you all the best in going into the field of PM&R, as it's a wonderful field, and we look forward to seeing you during the interview season. Thank you.
Hi, everyone. My name is Leslie Begay. I am the Assistant Residency Program Director here at JFK Johnson Rehabilitation Institute. What you may not know about me is that I was actually a resident and chief resident here in the Department of PM&R at JFK Johnson Rehabilitation Institute. After graduating, I was hired as an attending faculty member in the Department of PM&R. My clinical duties most recently have been include developing and being the medical director of our cancer rehabilitation program, which I'm really excited about. In addition, I get to work with the residents and in resident education as the Assistant Residency Program Director. I also get to work with medical students as the Clinical Assistant Professor, both for the 2 medical schools that we work with, Rutgers Robert Wood Johnson Medical School and Hackensack Meridian School of Medicine. Since I was a resident here at JFK Johnson Rehab, the department is more than doubled in size, both with attending faculty and staff. This has led to the creation of many new programs because of the diverse interests and specialties that our faculty work in. Some of the things I wanted to talk about are our aftercare and stroke recovery program and our cancer rehabilitation program, which follow patients with ongoing rehab needs in the outpatient arena. We also have a very robust concussion clinic here, and our Center for Sports and Spine Medicine provides ample opportunities in musculoskeletal and pain medicine for our residents. Something else I wanted to highlight was that many of our graduates actually stay on and become faculty here at JFK Johnson Rehab. Some start right after residency, like myself, and others go on to do fellowships in other areas and then return and bring their new skills with them. I think this really speaks not only to our residency program, but also to our Department of PM&R here at JFK. Some of the things that I really enjoy about the culture of our department include the teamwork, collaboration, communication, and patient-centered nature. Our attendings and residents work together many times on presentations, research projects, publications, and book chapters. Every day, our attendings and residents also work together with our therapy teams, nurses, and other staff to provide the best care possible for our rehab patients. I hope this gave you a little bit of information and knowledge about why I have really enjoyed training at and staying at JFK Johnson Rehabilitation Institute. I hope to meet all of you again soon.
Alrighty, where's the screen with, is this just everyone? Oh, there we go. Alrighty, so we'll introduce ourselves. Are we still screen sharing? I think so, right? Okay, sorry about that. So we'll go around and introduce ourselves. I'm Jessica. I am a PGY4. I'm going into pediatrics. Hopefully, I just applied. And I guess we'll say what we like about JFK or why we chose JFK. So I went to Robert Wood Johnson Medical School. So JFK was my home institution for rehab. And something I've always really loved about the program are the people. When I came back for interview, the secretaries remembered me, the attendings remembered me, and I always just really had this feeling of, people wanting you to be here. It's also really special that on our rotations, you work one-on-one with attendings. So you really get to know them, not only professionally, but also personally. I feel like all of them really care about the residents, are really dedicated to our professional and personal growth. So that's something I really love about this program.
My name is Malcolm Carson. I'm one of the PGY4 residents here. And so one of the things that really drew me to this program was kind of its academic structure and the curriculum. It kind of goes without saying that Dr. C is very well known as it pertains to, curriculum and boards based on her, board review book. We do have a, 100%, board pass rate here. So I was very focused on the academics. And so, you will certainly get everything and more that you need from an academic standpoint coming to this institution, one, just from our, frequent going over our board review book, but also the attendings here are excellent in all of their subspecialties. In addition to that, they really make sure we get all the time in order to facilitate that, which isn't necessarily the case, everywhere. So I really appreciated that. And yeah, those are the big things.
Pretty much it.
Yeah.
All right. My name is Qasim Babar. I'm one of the academic chiefs at PGY4. So I'm from New Jersey originally. So this was one of my top programs. I volunteered here in the neurology department when I was going into college. So I kind of had a background history with JFK Medical Center. And then when I decided I want to go into PM&R, it was a perfect fit that JFK Johnson Rehab was connected to JFK Medical Center. And then when I got here as a PGY2, you're basically, it's inpatient heavy. But one of the great things is that we're attached to acute care hospital, like Dr. C said in the video. It's a super beneficial whenever we need to transfer patients that are acutely ill from rehab upstairs. It's a pretty easy process. And then also something that Dr. C harped on in the video that's really beneficial is the fact that most of our consultants here are private consultants. So they actually want your consults. They're really happy to teach, and it actually works out in a huge beneficial way because you're able to focus on the rehab side as opposed to the medical perspective. Otherwise, some other perks about this program, because I'm a huge foodie, we get free food here. We actually just had our whole cafeteria revamped. Private contractor came in and made it like 10 times better. So we have really good food here now, and we have pretty much like $24 a day, which is we get leftover money to like get food to bring home as well, which is great during residency.
And the other thing I wanted to mention was that in addition to the logistical things, that come with being attached to a acute care hospital, we're also excellent when it comes to the procedural aspects of things. We get way more EMGs than we really need. I think I missed a lot of time because I got off time for my wedding, and the attending also had to help with the interviews. So I didn't get as much as your average person, and I'm already at 150, and I'm only halfway through the expected curriculum. So most people hit in the 300 to 400 range for EMGs, as well as all the other, procedures that we need in terms of MSK injections. We have our monthly ultrasound lectures, and we can also rotate with the pain specialist. So it looks like there's only a couple more minutes left. We just wanted to open up the floor for questioning, be it in the chat or directly if you want to unmute yourself and speak.
Don't all ask at once. And I'll write our email in the chat. So if you guys think of anything.
So you can unmute yourself and ask a question, or you can type it in the chat.
Yep, I think you, all right, you mentioned the optional sport.
Sure. Are you talking about the sports coverage?
Yeah, she kind of just went through it quickly, so I didn't get to hear the whole thing, but I think it was regarding sports coverage. Thank you.
Yeah, so we follow 2 high school football teams that we are the primary physician on the field for. They're nice because you also get paid for them. So that's kind of a perk. And you're working directly with the trainers on the field. We also, one of the residents also recently connected with Rutgers, and we've been working with their sports medicine too, kind of shadowing them. I went to one of the basketball games, which was super fun, and you get to sit courtside and scan the players and take them back to the gym and, and assess any injuries. So those have been the main experiences with that.
Yeah, Costum's not going to say it right now, but he got to be here when when the Rutgers team beat
#1 seed Purdue,
and they
stormed the court.
in the nation on the walk-off shot by Harper Jr.
Yeah,
so that was cool.
Yeah. So yeah, basically the football and the basketball teams is basically the sports coverage he was mentioning.
Yeah. And then next question is
Call schedule.
Is about call schedule.
Oh yeah, good question. So here at JFK, we do home call. So basically, whenever you finish your clinical duties, typically at like 5 o'clock, 5 p.m., as long as there's no late admissions, you can go home. And then basically you can answer pages from home, and if there's any falls or any acute rapids, any medical issues that need to be addressed in person, then you'd have to come back. So generally it's expected that you live within like a 20 to 30 minute driving distance to the hospital. But yeah, typically it's home call for the most part. And then weekends, you do 7 weekends as the PGY2, 5 as a PGY3, and then 1 as a PGY4. So your weekend call structure is set up that you're on call from Friday at 5 p.m. all the way till Monday at 8 a.m. But it's home call. So you come in on Saturday and Sunday morning, you round on the patients, you do the progress notes, and you do any admissions that come in. Generally on Sundays, there's no admissions. The good thing about doing a weekend call here is that you do get paid for it. So generally you get paid about $300 to do the notes from the attending that's on call. And then for any admissions that come in, you get paid $60 per admission from the rehabilitation program. So at least you're incentivized. And then as you progress throughout the years, your weekend calls go down. As a PGY4, you do one in the beginning and then you're done. So that's pretty much how the call system is structured. Anything I miss?
I think that's the main points. I think we're going to run out of time, but if you have any other questions, please email. I put it in the chat, jfkchiefs@gmail.com. Thank you so much for your time and best of luck to all of you.
Take care.
All right, take care, guys.
JFK Johnson, thank you for a great presentation.